Okay. Good morning, everyone. Welcome to CalCASA's Unifying Community and System Series, Connecting Faith-Based Communities and Prison Systems. Thank you for joining us this morning for the web conference, and we will get started right now. We are going to have Tori. She is going to explain how to use your Adobe Connect, and she will move us forward, and then myself and our guests will continue with the web conference.
Thanks, Adrienne. Thank you, everyone, for joining us today. So we are using Adobe Connect for today's web conference and wanted to let you know a little bit about the features that we have. On the right side of your screen, you will see there is a text chat where all of you are welcome to introduce yourselves, tell us where you're from. Adrienne also will be posting some questions in the text chat for you all to interact with later in today's web conference. You can also send private chats to us or to each other. I will be using the account name Ashley Klein on Adobe Connect. So if you have any technology issues, please don't hesitate to send me a private message using the Ashley Klein Adobe Connect account. We do have the PowerPoint slides available on the screen right now. I don't believe we'll be asking any polling questions today. There is a phone number if you all are having difficulty streaming audio over the internet, and I will post in the text chat that phone number shortly. We do have closed captioning provided by our friends at Aberdeen Captioning. Thank you, Aberdeen, for providing that service today. And we're not in person with each other, but that doesn't mean that we can't interact with each other. So please use the text chat, ask questions. Feel free to let us know what you're thinking in the text chat. So Adrienne, I will hand it back over to you.
Thank you, Tori. So once again, my name is Adrienne Spires, and I'm a project coordinator here at CalCASA. And I coordinate our faith project here at CalCASA, and I also coordinate the LEAP project that we host here with our partners, Women of Color Network, and LEAP stands for Leadership, Education, and Advancement for Professionals. And I would like to introduce our guests. We have Shayla Ashmore, and she is the Director of Child Abuse Treatment Program at Lassen Family Services located in Susanville, California. And we also have Jenny Hoffman. Unfortunately, her photo isn't here, but she is a PREA manager and CASA manager at Lassen Family Services located in Susanville, California.
Good morning.
Good morning.
Thank you so much. And so I would just like to basically state CalCASA's mission. CalCASA, which stands for California Coalition Against Sexual Assault, we are committed to ending sexual violence through a multifaceted approach of prevention, intervention, education, research, advocacy, and public policy. And so the objectives for today's web conference, we want to review the prevalence of sexual assault in rural areas, highlight partnerships between community-based agencies and the prison and the faith-based systems, and also model collaborations to assess resources. And so, also we want to just introduce the prevalence of sexual assault in rural communities. And that is one of the reasons why we're having this series and talking about rural communities and the importance of collaborations between systems.
So in our rural communities, we are commonly recognized as a non-metro or urban area. In the United States, 94% of our land mass is considered a rural open space. 80% of the land mass in California is considered rural. And in California, 44 counties are considered rural, Lassen County being one of them, and we're in the extreme northern part of California. So our county is large, but very rural at the same time. our challenges that we do face within a rural county and a rural agency is isolation, social attitudes, limited resources, not in my town attitude, lack of the anonymity and confidentiality, which we see here in Susanville quite a bit because everybody knows everybody because we are such a small community, and growing in diversity.
And so now we are going to expound on the partnership. So the partnership, working with rural communities and systems and organizations in rural communities. And today we're going to talk about the partnership with the faith community in PREA. And so this is a project that CalCASA continuously focuses on and will move forward with as well.
So here in Lawson, we've been partnering with Just Detention International and California CASA for approximately about 10 years now. Within our facilities, we have 2 CDCR facilities and 1 federal facility within our county, plus our adult detention facility. So we are quite active within our within the CDCRs and the FDI program in Herlong. So we are able to receive phone calls and letters from the inmates that are survivors of sexual assault. We are trying to currently upload and get started with a emailing system through CDCR that we're hoping to get up and going within the next year or 2, so that way the inmates can individually email us and confidentially be able to talk to us that way also. We do receive quite a few phone calls and letters throughout each month, approximately about 3 to 5 between phone calls and letters every month. The purpose of PREA is to eliminate abuse in the corrections and law enforcement facilities, to increase the accountability of the corrections agencies, and to give incarcerated survivors the same level of care as those that are received in the community. And unfortunately, sometimes that same level of care for incarcerated survivors is not as much as what they would receive in the facility, which is what we're up here in Susanville trying to ameliorate, is to be able to go in and help them with their needs and services. Here at Lassen Family Services, we do provide comprehensive services to incarcerated survivors under the Advancing PREA project. We do participate in peer leading opportunities, providing feedback for best practices and sharing experiences with Advanced PREA team, and we do commit to building substantiable systems of advocacy within the organization for support for incarcerated survivors, such as our letter writing and being able to go within the walls to talk to the survivors.
And so to build off of the prevention, healing, advocacy, safety, education component, this is where the Faith Project comes in, CalCASA and Samaritan Faith Church, and 6 churches in Lassen Family Services. We hosted, CalCASA hosted a pilot program for faith leaders in Susanville to basically learn more about prevention and advocacy and education around sexual violence. And so the 6 churches that's on the screen are the 6 churches that participated, meaning that pastoral, people from the pastoral leadership team as well as some congregant members were a part of this 8 to 9 month learning collaborative or a cohort. So they met once a month on Saturdays for 3 to 4 hours, and we utilized the curriculum from Samaritan Faith Church. And that curriculum consisted of prevention of child sexual abuse, sex offender management, how to work with survivors of sexual violence, survivors of childhood sexual violence, as well as survivors of adult sexual violence. And so this was the opportunity for faith organizations to come together and learn. But most importantly, and what we have noticed and what has been communicated back to CalCASA is that the faith community, they really like to have scripture or some type of holy text connected to the actual training because that's their focus is faith, and they really want to have the holy text. And this curriculum consisted of that and provided that for the participants of this Learning Collaborative cohort or faith pilot program that was launched in Susanville, California, Lassen County.
It also gave us the opportunity to include that faith-based and scriptural and holy text reference in our own plan for each church. Each church did a mission statement and a plan on how we would prevent sexual abuse of the children in our congregations, and also how we would incorporate forgiveness and restoration of those members or attendees who were perpetrators of sexual violence or gender-based violence against children, and how each church would make sure that we kept the children safe but still allow for continued worship and participation by perpetrators of sexual violence who were seeking restoration.
Yes. And one of the things also with this, this was an opportunity for the faith leaders to merge their language with the knowledge of the anti-sexual violence movement. And so this made the Learning Collaborative, the pilot program, really engaging because it showed how faith organizations and we are anti-sexual violence feel and viewed, and we are a secular organization. This is opportunity for faith and the secular communities to come together and see how we can address, become more aware of sexual violence, and to have a better understanding of both systems so we can come together collectively and figure out a way how to work together and to also help eradicate sexual violence and have a shift in culture as well. And so I mentioned the training hub. So the training hub, Community Church of Susanville, they were the church that was the training hub. And so they were the ones that helped put together and recruit faith leaders from various faith organizations in Susanville, California, to be a part of this pilot program. And so you will see also Lake, at the bottom of the screen, Eagle Lake Community Church, Samaritan Faith Church in CalCASA. This is the partnership that came together to make sure that we were able to work collectively to unify these two systems per se, to address sexual violence. And so the training hub, it was to work deeply with groups of 7 to 10 faith-based organizations, and we had 6. And some of the faith-based organizations, they were wearing 2 hats. Some belonged to 2 churches at the time. They were members of one church, a part of a pastoral leadership team, and then they were moving on to another faith organization. So over 1 year to shift the culture, this was an opportunity for these faith organizations not to be in denial but also have apathy about child sexual abuse and to protect and to be proactive about engagement in faith-rooted organizations and communities. And so I know that I'm using some language that some people are not familiar with. Faith-rooted is basically, it means that it's completely guided and shaped by faith, and is designed to enable people of faith to contribute their unique gifts to the broader movement for justice. And so we use interchangeably faith-rooted and faith-based here at CalCASA because we work with multiple faith organizations. And so that is also one of the things that we wanted to highlight in this training hub, and to create a safe place to keep children safe from sexual and other forms of abuse, and to support and honor survivors. But also know that we can work with multiple faith organizations to bring about a training hub.
And the participants they really ran the gamut from people who had no experience with gender-based violence, so all of the information was new to them. To people, for instance, from community church who were on the Justice Task Force there and already working with trafficked individuals and victims of gender-based violence, to people who were actually personally victims of gender-based violence and were quite often emotionally and physically affected by what they were seeing in the very extensive detailed training. So it was really a good cross-section of the faith-based community and the different understandings of gender-based violence definitely enriched the training experience.
Mm-hmm. 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 And I would also like to share that, and if we did not provide this disclaimer in the very beginning, that Shayla, she was part of the pilot program, and she's a member of Community Church of Susanville, and she's also the director of the Child Abuse Treatment Program. Yeah, at Lassen Family Services. And so as I mentioned previously, some of the faith leaders and some of the participants in the pilot program, they wore more than one hat. And so having Shayla as a part of that pilot program was really rich, I think, for the participants and the faith leaders, because she, was part of that program as a faith, being a part of the faith community. But most importantly, she also had the understanding of child sexual abuse and working in the rural community, working in a rape crisis center and working with multiple systems. She was able to shed some light from a secular standpoint and most definitely the scripture standpoint, because some faith leaders really like to have scripture in or holy text connected to the curriculum of anti-sexual violence. And so having that hat, I think, really provided light that maybe some participants probably were not expecting before they were able to join this pilot program. And even some of the participants were, and they expressed that they were a little weary about the pilot program. And, we're focusing on anti-sexual violence and especially child sexual abuse.
We also had a caseworker from our local Child and Family Services CPS, Child Protective Services, and we had a social worker from our behavioral health department here in Lassen County. So between their input and mine, we definitely had a good cross-section, an intersection between the faith-based community and the secular community.
Yeah, yeah. And that goes to show also the importance of partnership and how we have people from different systems and different institutions coming together, having meeting of the minds, but also having an opportunity to learn together and look at different perspectives. And so thank you so much for Shayla for sharing that with the audience.
You're welcome.
And so I would like for Shayla to expound on additional projects that basically piggybacked off of the pilot program in Susanville and work that they're currently doing in Susanville that from the actual pilot program.
One of the elements of the training is a workshop called Tamar Speaks, and it's based on the biblical story of the Israeli king David and his son who raped his half-sister, and that was Tamar, and she was told to be quiet and not talk about it. So it was an opportunity for victims of gender-based violence to participate and tell their stories and talk about how it affected them. And out of that group of people who met for that, Peter actually started another training based on Dan Allender's book, Healing the Wounded Heart. And he had, I think it was a 12-part audio workshop from Dr. Allender. And out of that, a support group formed, and we are still meeting weekly for survivors of gender-based violence to go through that book and the accompanying workbook and work through remaining issues. I don't know if you're how many are familiar with the Adverse Childhood Experiences study, but adverse childhood experiences lead to 12 times higher rate of suicide, ischemic heart disease, all kinds of medical conditions, behavioral conditions, mental health conditions. So working through the issues from the arousal that develops from gender-based violence really helps to prevent those kind of outcomes for survivors. And we're still meeting weekly. In fact, we met last night.
Thank you. And I think that that's something that survivors that are heavily rely on their faith should know that there are opportunities and there's support for them that, you know, from the faith perspective as well as from the sexual assault, anti-sexual assault movement where we are survivor-centered. And so from the experience that I had, I used to be an outreach counselor in the state of Illinois, and I came across a lot of survivors who relied heavily on their faith, and they really wanted to have some support or work with someone that was familiar with faith, or at least acknowledge their faith and respected their faith if it wasn't a traditional faith. And they, from what some of the survivors shared with me in the past, they knew that getting on a path of healing was important for them to be able to incorporate their faith in their path of healing. And so to see that Shayla and Peter are co-facilitating support groups that has piggybacked off the pilot program and has an actual faith component in there for survivors, I think that's I applaud that, and we want to make sure that we are diverse in the services that we offer to survivors, and we want to make sure that they have a menu of supports that they can pick from. And so this is another entree on the menu that they can pick from in Susanville, and hopefully this will be an opportunity to spread other support groups throughout the state of California and elsewhere, and use this as a model to help support survivors that are looking for faith-driven support.
And I should mention that we have male participants in that support group as well, which is very encouraging to me because, as the training points out, men are much less likely to come forward for support after an episode or surviving gender-based violence.
Yeah. Yeah.
Especially in rural communities.
Mm-hmm. And so that goes back to the isolation, right, and everyone knowing each other. And so, you know, we think about for survivors that are women and girls, the challenges that they have with disclosure. And so it's even more challenging for men to disclose, and I think also being in a rural community. But for the ones that do feel comfortable enough and know that there's a platform for them to disclose and receive support while, you know, when they decide to disclose, I think that will provide opportunities for other male survivors to be able to utilize the services and know that it's not just for women, and also know that there are services that are readily available for them and welcome them as well. So now I would like to talk about myself and Shayla. And so in Susanville, California, the Community Church of Susanville, they host this Empower Conference every year, and I think maybe for 4 to 5 years, they have been hosting this. And this Empower Conference, and the title from last year of October 27, 2018, it was Speaking Up for Those Who Cannot Speak for Themselves. So the Community Church of Susanville, which was the training hub of the pilot program, they have Justice Task Force in that church where they focus on poverty, violence and abuse, and human trafficking. And so they hosted this conference in Susanville, and there were a lot of people in the community and from multiple and various churches that attended. And so at this conference, myself and Linda Crockett from Samaritan State Church, who wrote and put together the curriculum that we use for the pilot project, we were guest speakers there. And this conference was great, for one, because it was hosted by a faith organization. And Community Church of Susanville is one of the largest congregations in Lassen County. And they had maybe a little over 100, maybe more participants who came and, to listen to the speakers and to learn more about what is taking place in those three areas that Community Church of Susanville, their Justice Task Force, addressed. And so one of the areas that I focused on was working with non-offending parents. And non-offending parents is basically a parent who did not sexually abuse their child. And so looking at ways that the faith community can support non-offending parents, but also continue to become more aware and understand and help with the cultural shift when it comes to anti-sexual violence. And so I put a call out to the faith community to look at ways that they could really support non-offending parents, because faith communities and faith organizations, one of the things that they really focus on is healing. And there are a lot of non-offending parents that are looking to heal. So we talk about various forms of sexual violence in the curriculum, throughout the curriculum, but this is something else that came out of the curriculum, and we wanted to build off of that as well. And so this conference was really, it was exciting to see that a faith organization was hosting such a conference. And so as you see, the cover of the handout, the program was Empower, and they also used in the inside cover, they quoted Psalms 82:3-4, give justice to the weak and the fatherless, maintain the right of afflicted and the destitute, rescue the weak and the needy, deliver them from the hand of the wicked. And so this conference was enlightening, and this was something that the pilot program was a part of, and also hosted some of the faith leaders from the pilot program hosted and was on the actual planning committee for this conference in Susanville, the Empower Conference. Okay, so one of the reasons, some people ask, why do we need to engage faith-based organizations in a movement building to end gender-based violence? So these are the reasons why. Opportunities to impact large numbers of people. Faith organizations are a system and an institution within themselves. Even if people are not part of that faith organizations are embedded in communities. And so if people go to faith communities not just for worship service, some of them go for other services and other ministries that the faith organization hosts. So it could be a food pantry, it could be a daycare, they could have sports for youth. They have so many other ministries that they host that people participate in that are not actual members of that faith organization. We also want to have faith organizations engaged by calling on common faith-based values using holy texts, as I stated, scripture narratives, so we can inspire people of faith to become proactive in preventing gender-based violence in their faith-rooted organizations and communities. Also, people of faith were key in past social movements, for instance, ending slavery, civil rights movement. And also, we want to take a look at when faith is grounded and committed to social change, significant staying power is available for long-term work. And so this is another reason we want to make sure that the faith community is engaged and that we're engaged with them as well. And not just for them to host a site or to have meetings, not just for them to give us donations, but we really want their language and their voices to merge with the language and the knowledge and the voices of this movement in this field.
In addition, the participants were united in a commitment that the faith-based community should be a safe space in the community, and that we all agreed we wanted the faith-based community to be the last place where people should have to worry about gender-based violence.
Okay. Yes. And so this is what is required to end gender-based violence: a systematic approach to shifting culture while simultaneously creating policies and practices to sustain a positive shift. And as Shayla stated earlier, the pilot program, the faith organizations that were part of it, they looked at, the practices that were currently embedded in their faith organizations, and then they also looked at the educational focus every month when they attended the actual pilot program meetings on Saturday mornings. And they looked at the educational focus that they were introduced to. They also looked at the practices that were embedded in their faith organizations. And then they looked at how is it that they can either shape and or reshape policies that was already part of their faith organization. So this provided the faith organizations to look at policies and practices, and that is very important in order to shift culture. Also, ending gender-based violence, it means moving beyond education, awareness, raising, and service to changing social norms, values, and behaviors. So when I say that, sometimes people say, well, I don't know. And sometimes it's true, we don't know what we don't know. And so sometimes we just bring about awareness. And so with this pilot program and working with faith organizations, we wanted to go beyond awareness. And we also wanted to bring about more understanding. And how do we put our understanding into practice, and how do we implement what we understand? And also, not just for the anti-sexual violence movement to teach the faith organization, but also so the faith organization can teach us some of the concerns that they have and some of the things that they were not aware of. And so when we're not aware of what people are not aware of, that provides us a better opportunity to think about more preventive strategies and think about how can we intervene differently. How can we be creative in our intervention services and our intervention practices? And so this is the opportunity for all the systems to come together and have a meetings of the mind and figure out how do we really change culture, and what is the core work of social movement building. And that is the core of social movement building. It's for us to come together and to share our perspectives, share what we know and what we don't know, and how do we foresee a better way of addressing, understanding, and help eradicate gender-based violence.
And as far as the understanding goes, the training includes a church-wide training session. So the entire congregation is invited to a session to be trained about gender-based violence and how the church is going to address it. And there's a lot of denial in church communities. That kind of thing does not happen here. But faced with participants in this cooperative who are actual victims of faith-based community gender-based violence, that it's impossible to maintain denial when the presenter is a person who can say, but I was a victim of gender-based violence in a church.
Mm-hmm.
So changing the core, the social movement building, changing the core culture, one of the first things you have to get past is denial. Not just in the church, but in a rural community, there are people who will say that kind of thing does not happen here. And when they are faced with participants who say, but it happened to me, that they can't maintain that denial.
And so now we want to take a look at, to increase collaboration between faith-based organizations and anti-gender-based violence organizations. How do we maximize opportunities to help promote healing and help eradicate gender-based violence? And so one of the ways is this pilot program. Another way is for our rape crisis centers here in the state of California to be this model and to show how is it that we work with other faith organizations beyond just utilizing their space for meetings, also really getting them involved. And so we want to figure out how do we continue to build this collaborative opportunity. And so one of the things that CalCASA is doing is we're building off of how do we change public perception of sexual violence in rural communities? How do we change public perception of how do we work with faith-led organizations? And so this is the way. So we're looking at ways to really collaborate with faith organizations. And one of the ways is basically having the training and having, people from our rape crisis centers or the anti-gender-based violence organizations to have collaborative trainings with faith organizations. Also looking at how do they interpret the curriculum that we use when we are hosting volunteer training. Also, how do they interpret the curriculum that we use, that our rape crisis centers use when they're training their advocates, when they're training their counselors, adult counselors as well as counselors for children? How do we also take a look at how would they interpret and or summarize our prevention education? Do they understand what prevention education looks like when we have, when there's rape crisis centers going out to schools from K through 12 as well as on college campuses? Do they understand why is it that we're doing that? Do they understand our outline and our approach? Do they understand why we're doing that? But also, this is for us as an anti-gender-based violence organization and a movement to take a look at what do they suggest? How would they utilize the information that we basically disseminate and train our volunteers as well as our staff? How would they summarize that? How would they better understand that? What would be easier for them to digest? And it may be some words and language that they could share with us where we could really reach survivors, victim survivors, as well as in the prevention component, be able to use some language that will help people, those particular populations, understand our curriculum, understand our approach, understand how we, use prevention and our preventive strategies. And so this is a way for us to increase our collaboration, is to listen to both and the two different systems and learn from one another and make sure that we come together and not trying to have one system think that they're going to be the ones to teach each other, but as opposed to that, we will be able to learn from one another and to take classes together. So it's sort of like when you're in school, you have to have these presentations and you learn about your peers, their thought process, and what they're thinking and how they will put their learning into practice.
So some of the concerns that arose during the training and as part of the collaboration were the reluctance and or feeling of inadequacy around the issue of prevention efforts and identifying victims of child sexual abuse. The training actually has some role plays and scenarios where a person, for instance, teaching a Sunday school class is approached by a child who says, but what if the person who you're supposed to trust is the person who's hurting you, or things like that. And so we definitely found that there is a need to educate all of those who are involved in providing services through a faith-based organization in how to identify child sexual abuse and to educate them on what it consists of and that it is possible within the church. And of course, we had to address very many different audiences and populations in faith-based organizations: offenders, adults molested as children, current survivors. There was a question earlier on the slides about how gender violence within the LGBTQ community was addressed in this training, and it is included in the training materials, but there is a greater reluctance in rural areas for members of the LGBTQ community to come forward in a faith-based setting. So that in itself is an issue that has to be addressed, And then there has to be training and education on how identifying child sexual abuse and how services are provided in that community. That's another hurdle to overcome. We also had to figure out what services are available for crisis counseling and advocacy in our community, and the cross-section was really important in addressing those concerns.
So I would like to share a quote from Pastor Jacob Simpson. He is from Trinity Lutheran Church in White Plains, New York, and he's a friend of mine. So I tend to reach out to him because he does anti-gender-based violence work in his church. And so he was once upon a time at a church in Baltimore, and now he's at a church in New York. And this is a quote he shared. We had a web conference maybe like a year and a half ago. And one of the things he said was faith communities do want to help on this issue, especially in the wake of #MeToo. They do not always have the language and are not always confident approaching secular organizations. And so I thought that his quote was befitting because that's one of the things that we really want to focus on. How do we really work with faith-led organizations? How do we have a better understanding of their language? And how do we let them know that they can approach secular organizations, i.e. the anti-sexual violence movement? But most importantly, let them know that we want to reach out to them as well. And we want them to know that that is a concern of ours. It's, the #MeToo. And so, some faith organizations and faith leaders, when they became familiar with the #MeToo, which I think everyone became familiar with, it became very popular, that hashtag, and it uncovered so much sexual violence in different systems, but then other hashtags came out. #Church2 came out. And there was just so many different hashtags that came out. And, for this pastor to say that they really do want to help in this issue, but not having a confidence. And so I think that the faith community as well as the sexual violence field, we need to have as much confidence to know that it is perfectly okay for us to reach, over to them and they can reach to us. And so we could really address this #MeToo. However, this movement has been around way before #MeToo. So we are quite familiar with what sexual violence has done and what it's continuing to do and how it's continuing to grow. And so I just really like the quote that he shared with us, and that he is, he spoke for his other peers that's in the faith community, that they do want to have the confidence to work with this movement and to address this issue. So that was very refreshing to hear, and to know that we have additional opportunities to work with faith leaders that want to learn as much as we want to learn as well. So one of the things I want to talk about is the intersection of faith-based organizations and rape crisis centers. And so faith-based organizations, they assist congregants and communities to heal physically, socially, and spiritually. They can also be effective agents of prevention and intervention. And so there's a lot of intersection here. And so also anti-gender-based violence organizations, they assist victim survivors to get on the path of healing through counseling, therapy, support groups, and advocacy and crisis hotlines. And so we're doing pretty much the same work. The faith organizations and rape crisis centers are doing the same work, but they're titled differently. So what the faith community, they talk about healing physically. They're talking about socially and spiritually. But our rape crisis centers, we're talking about healing through counseling and therapy and support groups and advocacy. And even some of our rape crisis centers, they offer trauma yoga. They offer the spiritual growth, even though they don't say spiritually, but they do offer spiritually and socially support for victim survivors to get out and feel a little more confident in their spiritual growth, even though they don't say it. And that's through therapy and counseling. And so there's so many intersections between the faith-based organizations and rape crisis centers that I think that people don't realize that we have way more similarities than differences. And if we could just build off these similarities, I think it would be vital and much helpful for this movement, this culture shift, and to help survivors get on the path of healing, but also how we could come together and have more preventive work as well. Also, thinking about faith organizations, they don't have a crisis hotline, but a lot of faith leaders have disclosed that they get a lot of calls. Their pastoral leadership team get a lot of calls when people are in dire need of support. So they don't have a crisis hotline per se, but the congregants and people in that community know that they could call on their faith organizations to support them in whatever needs that they may need, if it's socially, spiritually, physically, just like our rape crisis centers. People know they could call our crisis hotline 24 hours if they are actual victim survivor, or if they're a non-offending parent, or if they have questions. People know that our crisis hotlines at the rape crisis centers are always readily available to support anyone and everyone that have questions and are in need of support. So I wanted to just point that out there because, you know, when I started doing mapping and doing actual surveys with faith organizations and faith leaders, I let them know, you know, our rape crisis centers and this movement has so much in common with faith organizations. And some of the faith leaders were taken aback, like, how so? Because that's odd to hear someone say, I work at a rape crisis center, and we have a lot of similarities with your faith-led organization. And when I shared with the faith leaders the things that they do and the things that we do, our language is just different. And so that's why, you know, it's important for us to come together and to become aware together, understand together, and learn together, because we're doing the very similar things, but we don't have the same language. And so we can figure out a customized language and to work together. This will really help with the culture shift. It will help with the eradication of sexual violence, and it will really amp up our preventive strategies as two different systems. So I have, you know, we have some questions, and this is where we would like for the audience to please get engaged and respond to the questions. But first, I'm going to have Shayla and Jenny. They're going to respond to these questions. And so the question is, what has been the biggest challenge in ensuring that the voice of your community is acknowledged while providing services to specific communities?
I think the biggest challenge is finding the voice of our community. It's not always a unified voice. There are many different elements in a community, even a rural community, especially one that has prisons, so there's a large segment of the population involved in law enforcement and corrections, and other aspects of the community that are not involved in those at all. So deciding what is the voice of the community, I think, would be the biggest part of that challenge. And trying to find a unified voice would also be a challenge.
And I would say, coming from my perspective, is that we do have our challenges, but we're able to understand what those challenges are by giving our survivors that we do serve surveys and getting feedback from those surveys. And also we're able to have our collaboration with our community partners, such as Community Church, with what the challenges is that they're seeing that we are not seeing. And then also just educating our community what is going on in our area.
Yeah. So one of the biggest challenges that I noticed while initiating the pilot program in Susanville, the challenge was some faith leaders didn't think that their voices were being recognized, or that this movement wanted to hear their voices. And that was a challenge, you know, for some of the faith organizations to get aboard of the pilot program. You know, faith communities sometimes don't feel as welcome in this movement. And I think historically they have had some challenges, this movement and faith-led organizations to come together. And so going back to Pastor Jake Simpson's quote where he said that they do want to help in this movement and this issue, especially in the wake of #MeToo. They just do not know how or have the language and are not always confident in approaching secular organizations. And I think this is one of the biggest challenges is the language barrier, right? So when we think of language barrier, we think of cultural and linguistic barriers. And this is a cultural and linguistic barrier of the faith community and this movement. And so that is one of the biggest challenges. And so that I have noticed initiating this project. And so we learned a lot initiating this project and being able to execute this project, and now seeing that Shayla and Peter now are co-hosting and co-facilitating support groups of survivors of sexual violence by utilizing the section of the training curriculum of Tamar Speaks and using scripture and holy text to support the support groups for victim survivors. I think that this is one of the biggest challenges, and I think that with this challenge, it's going to help us become more innovative and really extend the conversations between the faith communities, faith leaders, the anti-gender-based violence movement and rape crisis centers. Is how do we address these challenges and make them smaller and make the work that we're doing bigger.
And get all the voices to speak.
Mm-hmm. Absolutely.
Instead of remaining silent.
Exactly, and I'm looking forward to that. I'm hoping that we will be able to build off of this. And I would like to ask any of the audience, do you have any responses to this question? What has been the biggest challenge in ensuring that the voice of your community is acknowledged while providing services to specific communities? Can any of the audience speak to that? Can you respond in the chat? We would love to hear your response, or if this is not a challenge for you, share with us if it's not a challenge and or if it is. Okay, so we will move to the next question. So the next question for Jenny and Shayla is, what has been the biggest challenge in ensuring that you stay true to your mission as you collaborate with other systems?
You know, we really haven't, I haven't really seen any challenges, and that's one of the perks of being in a smaller community is that everyone is known by almost everyone else, and our community, fortunately, is aware of what our mission is here at Lassen Family Services, and that helps us to assure that that our community that is survivors are able to receive the services that they need.
For me, the biggest challenge is that I am first and foremost a therapist. So my job is to help people move toward healing in their mental and emotional health. When I address this issue as a member of a faith-based community, I am first and foremost a person of faith who is looking for spiritual healing. So part of the challenge is understanding which mission is first and foremost depending on the circumstances, and also understanding that a social worker from Child Protective Services has a different mission, and a behavioral health specialist for the county also has a different mission, and a pastor has a different mission. And understanding that if all those missions work together, the end result is a healthy, functioning, productive member of all of those communities. That's the biggest challenge, remembering that that's the outcome we're all looking for by providing services in our different roles.
Yeah. And so, Shayla, what you just stated is similar to making sure that we have the language, right? Being aware of everyone's mission and also their language. And this is the opportunity, and I use the word opportunity a lot, because there's so many opportunities out here. And opportunity, the word opportunity is so positive, right? And looking at how do we stay within our mission, but also carve out what are some similarities in the missions that we do have. And I think that when we think about systems and institutions, some of us have a lot of similar missions, and how do we unpack that and to make sure that we stay in alignment with our organization, but we're able to collaborate effectively and successfully. Okay. So for me, looking at the biggest challenge in ensuring that you stay true to your mission, as you know, as CalCASA, as I stated, I always want to make sure that we're able to collaborate and that we stay true to our mission. But also, you know, before you collaborate and build partnerships with other organizations, it's important to understand their mission and their vision, and to see if you guys are on the same page, a similar page, or if the collaboration is possible. And see what are some of the measurable outcomes that they have compared to what we have, and do we need to look at some measurable outcomes that we haven't even mentioned that's still within our mission, that would still support the collaboration, you know, between the two systems. And so looking at working with faith organizations and looking at working with PREA, you know, CalCASA really, you know, looked at their mission, and the mission, as we stated earlier, is to look at prevention and intervention, and how do we support that. You know, that is a commitment of CalCASA to end sexual violence through a multifaceted approach. And so with that being a part of our mission and looking at the multifaceted approach of prevention and intervention, education, research and advocacy and public policy, you know, we have a broad lens and a broad opportunity to work with other systems to address this. And so that's the way for me, you know, working at CalCASA and initiating the FAITH project is to make sure that I stay within the mission, but make sure that I'm very aware of the mission of the other systems that we're looking to collaborate with, and then get on a trajectory of a partnership. So I would like to know if any of the audience have any, you know, questions for our responses, or if you would like to chime in about any comments that you may have and any other experience that you may have, you know, staying within the mission of your organization, as well as some of the challenges that you may have experienced or some challenges that you may envision. Okay, Olga, thank you so much. Olga stated it has been a bit of a challenge, but the churches are doing what they can to help survivors without departing from the faith. And I totally agree with you, Olga, because you know, the faith community, they hold on to their mission. They hold on to their purpose. They hold on to their scripture and their holy text. And they tend to do things maybe a little different than we do. But as I stated, a lot of them do way more, their approach is way more similar as opposed to the language. But thank you so much for sharing that. Tessa has a question. How do you approach a faith system that encourages early marriage? So Shayla, would you like to respond to that?
I'm not aware of any systems in the Susanville area that actively encourage marriage for those under the age of 18. I know that they exist in some rural communities, but as far as I know, this is not one of them. I'm a child abuse treatment therapist, so I would expect that that might come up in my practice, and I haven't seen it here. But I would personally encourage waiting. So
I would like to piggyback off of that. It also, Tessa, it makes me wonder about the faith system that encouraged the early marriage under the age of 18. It makes me wonder if they're familiar with the laws in their state, and what does the law have to say. Also, some faith organizations, because of their faith, sometimes they have ways around the law. and so I'm very curious because I know that I have read articles where child marriage is growing in America. I'm just wondering if it's really growing, or is it that we have more access to the information and the data due to social media. And so it makes me wonder if these faith organizations are familiar with the laws in their community. And also, it makes me think about the age of consent as well. So if they're underage and they're being married under the age of 18, are those marriages, are they consenting to those marriages? And by law, can they consent to marriage under the age of 18? And then if they're married, if they're married, are they able to consent to sexual activity? So I'm really curious. So now I'm going to look this up, Tessa. And so if you could put your contact information in the chat. Well, actually, we have access to that because you registered. So now I'm very curious, and so now this is going to be a research project for me because I have not had that question, and Shayla's not familiar with that question, but that's something for us to think about. And once again, that goes back to us not knowing what we don't know, and now you have brought something to my attention, and now I want to know more about it. So thank you, and I'll be reaching out to you while I do this research.
I believe that as many as 48 out of the 50 states actually allow marriage for those under the age of 18 with parental circumstance or permission, or under circumstances such as pregnancy. So early child marriage is possible in the United States and not necessarily illegal.
Mm-hmm, mm-hmm.
But as far as brain development goes, since for females full brain development doesn't occur till 22 or 23, and for males it's more like 24 through 26, early marriage would not be consistent with what we know about brain development.
Okay. Well, thank you so much. And this also, now this is a question that I would like to pose to faith leaders that were part of the pilot program and other faith leaders that I know. And once again, it goes back to CalCASA looking at ways to work with faith leaders and having them to address, a volunteer manual that's being used throughout the state of California, an advocacy training manual, and just having the feedback and the input and the thoughts of faith leaders. And this is making me think of how we could even dive deeper into conversations and learning opportunities with faith leaders. So I would like to share Olga's statement. She stated, I was married at 17. This was not encouraged by the church, but allowed by our law. My parents signed a consent. It was a month before my 18th birthday. Thank you for sharing that, Olga. And Tessa stated, thank you, we have secular groups in our area where early childhood marriage is not illegal because parents give consent. And Tessa has another question. How do you even approach a leader of a church that condones this? For me, I would like to ask them to just help me to understand why is it that they condone it. And I know that sometimes people, the faith leaders, they reference the Old Testament, the New Testament, or some type of holy text from their faith. So I would like to, I'm always the type of person that would like to get understanding. I will pose a question, and if they condone it, I would like to understand better why. I'm not going to say better. I just would need to know and understand why is that, and dive in from that conversation. And it goes back to me always thinking we don't know what we don't know. And so I don't know why, but I will be really interested in asking. So now, Tessa, this is a question I'm going to be asking some of my faith, my friends that are faith leaders and in the faith community. Shayla, do you have a response to that?
I think I, like you, would have to sit down with the leaders of the faith community and find out how their culture condones that and what their cultural view of it is, and whether the circumstances make it advisable or inadvisable. Yeah, I think that's something that I would have to definitely approach on a case-by-case basis.
Yeah, most definitely. Hold on. Okay. So thank you, everyone, for participating in that part. So we're coming to a close. But before we close, I just would like to share, and we could talk about this, this is a publication that CalCASA put out in 2010, Stopping the Stigma, Changing Public Perceptions of Sexual Assault in Rural Communities. And so it is almost 10 years later, and we're still talking about how do we stop the stigma. We're still talking about how to change the perception. Now we're talking about how to have a cultural shift in rural communities and with faith communities in the secular organization, i.e. our movement, in the prison system. And we're also looking at how is it that, we can assist rape crisis centers in rural or remote areas in gaining support from their respective communities, and with the goal of creating partnerships to meet the needs of survivors in sexual violence in rural communities. And so this is something that has driven the current projects that CalCASA is currently a part of, and build a partnership with the prison system, and now, in the developmental and capacity building stages with faith organizations. And so, and I also put the link to this publication, this packet, in the chat. And so this is something for us to think about. What is it that this publication talked about then, almost 10 years ago, and what have we learned? How have we been able to build off of that? And what are some of the suggestions that was made then? And do we agree with those suggestions? And how can we build off of those suggestions? And so I noticed one of the things in this packet is strategies to use in safe communities, how to address the differences, and how do we tailor the message. And this is something that we're trying to do now. Also looking at how is it that we work together to promote healing and recovery. And these are the things that we're talking about. And at the end of the day, even though these are total different systems per se, where we may have some similar mission statements and visions, well, how is it that we're going to work together to promote healing? And so this is a really good packet. And how do we promote community and professional educational opportunities? And that is something that the pilot program did. This is an opportunity for professionals that's in the faith community to become educated about anti-sexual violence, and then from the prevention standpoint, and how is it that we're going to benefit with working with faith communities, and how is it that the secular organizations and movement is going to benefit as well. And so we also looking at in this packet, how do we strategize to work with local businesses? And so, and other county departments. So when we're thinking about county departments, we're thinking about, the mental health department, child and adult protective services, and the school district. And as Shayla stated earlier, she talked about some of the participants in the pilot program, how they wore different hats. Some of them wore the hat of being a part of a faith community, but some of them worked at CASA, and some of them worked at mental health agencies or child protective services or public health. And so these are the things that we want to do. We want to make sure that when we outreach with the other communities in these systems, how are we going to unify these systems? It's so important to make sure that people that are part of the unification come from multiple systems so we can all learn from one another. And also, other social service providers, how is it that those nonprofits and boards and committees may be more accessible, and also how can we as rape crisis centers reciprocate these relationships and work with these social service agencies and committees in our counties. And so I put the link in the chat, and this is something for us to chew on about this publication, and as we move forward working in these different systems, how do we work with faith organizations, the prison systems, and how do we ensure that all our missions are intact, and we also learn more and able to grasp hold to the missions of other systems that we work with. And so before we close out, are there any more questions, any more statements, anything that people would like to chime in about? It is 11:10, This web conference is scheduled to end at 11:30. And so if you have any more questions or any more thoughts that you would like to share, please share with us. We are open to hear and to learn, and for us to have takeaways, as well as one of you all to have takeaways as well. Shayla or Jenny, do you have any closing thoughts you would like to share with the audience?
No, I would just thank you for allowing me to be a part of this and for your work to start the conversation here in Lassen County, as well as starting the faith-based systems and the Samaritan Safe Church training. It's been very important and valuable in this community.
Thank you so much, Shayla. But I'll also like, I'm sorry, go ahead, Jenny.
Oh, I was just going to say thank you for giving me the opportunity to sit in on this web conference this morning, and I appreciate your time and effort that you've put into this, along with Shayla's time and effort that she's put out into this cause. So that's all I wanted to add.
Well, thank you too as well. And I want to, just state also that, Susanville, California is a really small region of the state of California, and California is huge. Even though Susanville is small, but Susanville is doing great things in that rural community. And I think that I would like for us to share and figure out ways to really share with our rape crisis centers about the support group that Shayla and Peter are co-facilitating. And I think that this could be a model for other rape crisis centers and other faith organizations and different communities throughout the state of California to think about how they could, collaborate in or partner on some of these support groups. We have various support groups. We have art therapy support groups. We have trauma yoga support groups. And I think that this support group that's being hosted in Susanville with Shayla and Peter, Shayla being a director of child abuse program, and Peter being an actual pastor of a faith-led organization, and being a Christian counselor. I think that this could be a great model for others throughout the state of California to take a look at, as well as partnering with other faith organizations within their communities where the rape crisis centers are located. So I am hopeful this could be a model, and we could share this more in depth with other rape crisis centers and faith-led organizations. So I would like to thank everyone for joining us for this web conference, and I appreciate the questions and the feedback and the statements. I appreciate the opportunity for us to do some, for me to do some research that Tessa has shared, with her question. So thank you once again for joining the Unifying Community and Systems series, connecting faith-based communities and prison systems. And I'm looking forward to another web conference building off of this system series. So I thank everyone. Have a great rest of the week. Oh, today is hump day, so have a great hump day and a great rest of your week. We will leave the chat open a little longer just in case people think of questions or statements that they would like to share. Also feel free to reach out to me if you have any questions, any concerns, and something that you may think of after the actual web conference. So I'm going to put my email address in the chat. So thank you, and
thank you.
Have a great day.
You too.
Oh, also I'd like to thank Tori as well for assisting us with Adobe Connect, and have a great day.